Welcome back. Now, some confusion is mounted over the advisability and merits of wearing face masks in public. So we're joined now by Liz Kingston, lecturer at the Department of Nursing and Midwifery at the University of Limerick. Where do you stand on this? Is it a good idea to make it compulsory for everyone to wear masks?
Well, I suppose this is new territory for all of us, Matt, and we're all learning as the situation evolves and as the new science emerges. And I think if face masks can offer some potential benefit, and if they can hasten the return to some sort of normality as restrictions begin to be eased, you'd have to ask the question, well, why not? I think if the benefits of wearing a face mask outweigh the potential risk, I believe it would be a very sensible and a very useful measure that could be introduced, especially in light of, as I said, potentially easing the restrictions and trying to get the economy and the country starting to move again.
Have the benefits been proven elsewhere?
So we know that, I suppose the backdrop is really to this conversation is that the European Centre for Disease Control, the ECDC, they've reviewed the science and they've released a technical paper, a report in relation to the use of face masks in public. And I suppose the context of the conversation really is around community transmission and the asymptomatic carriers. At the moment, we know that community transmission is at about 64% in Ireland. That's the latest figure from the government. And we know that asymptomatic carriers amount for somewhere between 40 to 50% of the cases of COVID that are being contracted. So the ECDC have said really that we could consider wearing face masks, particularly in public areas, in areas where we're likely to have close contact with people. So in other words, areas where we're not really able to maintain that social distance.
But Liz, are we likely to have enough of these face masks manufactured and available? Because wouldn't they have to be changed on a regular basis? One face mask per person isn't going to do the trick, is it?
Now, we know that the surgical face mask is the supply chain there is really important to protect. It's important to prioritise that supply chain for our frontline healthcare workers. And just last week, the HSE changed the guidelines around the use of surgical face masks and widened the parameters, if you like, for their use in healthcare settings.
Okay. And
on foot of that, the demand is going to go up, and we're going to need about 1 million face masks per day in healthcare settings.
Very briefly, so to finish, if you're in favour of the masks, what about gloves?
No, that's where we draw the line. We're not in favour of gloves. We know that hand hygiene works, and we know that this is hand sanitising with soap and water or with using a hand sanitizer. This is what works. The potential harm from wearing gloves in public places, it does not justify their use, really.
Thank you very much for that.
We're not recommending.
Very interesting. Liz Kingston from the University of Limerick, thank you very much for being with us on The Tonight Show. Cillian, I've noticed lots more people